Okay, and then to the left. Are you Zoolander? You can only turn one way on the runway.
Right. Gage has started limping, so we suspect a potential cranial cruciate ligament rupture, which is analogous to the ACL in humans. So the ACL is like what the football players and hockey players always like to tear out. Dogs have the same thing, but it's a cranial cruciate ligament. Gonna do an X-ray and manipulate the joint.
So he had had a history of limping, and then not limping, and then limping, and then not limping, and then finally seems like potentially a full tear. So we'll send the X-rays off to an AI software that helps us diagnose. So it's artificial intelligence that reads the radiology, and then also to an orthopedic surgeon for their opinion as well. This is a report from the AI company. It's called SignalPet. So essentially, you just send them your X-ray, and they use artificial intelligence to then read the X-rays based off of the databases that they've built using human radiologists, and then they come up with a report. They came up with gastric material, which there was food in the stomach, and then also osteophytosis, essentially bony changes in the elbow. So a human did not read these X-rays, and we still got a diagnosis. It's to give us a little bit of confidence in our diagnosis when we're seeing something, to have that extra check. But I wonder if it's more collateral ligaments.
These are prone to the knees.
Okay, Carly,
It's normal.
I think so. If there was a tear, it would move a lot more. There is some movement, but there's individual variation with movement too, but it's not enough. Did you take hip X-rays too? Maybe check the hips. Yeah, I think that's just me. If I push really hard, yeah, but.
So just looking at the hips now. And it looks really good. So what I'm gonna do is send off the radiographs to the AI software. Is that easy? And we'll get results back in 10 minutes and see what they have to say. We'll let this guy wake up.
Do you want me to reverse him?
Yeah, we can reverse him. Okay, so the artificial intelligence SignalPet is back. So for Gage, it gave us two abnormal findings. It does not think that there is stifle effusion, so that is the joint where that tear could potentially have been. So that they're saying that looks great, but what they did find is stifle periarticular osteophytosis. So that gives us an indication to then go back to the radiographs and to look at what we were looking at. So it was on the right side, which is the side we've been having some lameness issues. So we're gonna just zoom in on that area there. So right here, they're seeing some fuzziness. There's essentially some arthritis in the joint. So here and here, the joint surface seems to be roughened. And the other one that they found was also some disc changes here, right where the spine meets the pelvis. So there may be some arthritis changes going on right in this area. So based off of all of that, we have some indications of arthritis on the side that we're limping on. We're gonna take a video for the referring orthopedic surgeon, and we're gonna send that to them, and then also send off the radiographs to them as well, and come up with a plan from there. But using technology, X-rays, artificial intelligence, to put the picture all together and try to get this pup walking good again. Gage, our pitbull mix, is now going to be discharged on the X-rays. It doesn't look like there's too much serious going on in terms of a cruciate rupture. I feel like we have a mild drawer sign, which is one of the palpations that we do in order for us to make sure that that ligament is intact or not. And other than that, we'll just keep resting him and giving him some non-steroidal anti-inflammatories, some painkillers to help mitigate some of that pain. And he's walking a lot better today than he was 3 days ago, so that's a very good sign as well.
Cookies, Benefit logos, and a pit cookie of me.
Is that other?
Yes.
Yeah. No.
Yes.
Like a picture of your face on
Of
it?
me holding Peter.
You look like Robin Hood.
Oh my god.
It's like they made you into like a superhero. It looks like a superhero.
Why are you turning into such a big dog?
He was like one of our first dogs in clinic.
He was a little tiny puppy. He was a little tiny puppy.
I'm so excited. I'd share one with you if they were good for puppies, but now I'm gonna eat them all.
Gonna have to shout out Bree and the cookie cutter Airdrie. And then this one, it's me and Peter. Mmm, I taste good.
I'm gonna eat your head. So this is Lacey. She presented for vomiting and diarrhea for 3 days. She's quite inappetent. As soon as I assessed this dog, the first thing that came to the top of my head was pancreatitis. Just because of how painful she was in her cranial abdomen, with the vomiting and the diarrhea, this is kind of a normal thing. On her blood work, her CBC, her complete blood count was completely normal. Her chemistry also was fairly unremarkable, and then her CPL test was positive for pancreatitis. This dog doesn't have a huge history of getting into anything, so I did chat with the owner about just that it could mean generalized inflammation. It could also mean that there's a tumor on the pancreas. There's other things that could be causing this versus pancreatitis alone. So we discussed running more diagnostics to try to rule out other things, but the owner had decided to we'll start with some pancreatitis treatment and then move forward based on how she responds. In terms of treatment for pancreatitis, IV fluids, pain medication, and anti-nausea medication, and then just trying to entice them to eat. So we will try to get her to eat hopefully some low-fat food. If we're not seeing any improvement by this afternoon/tomorrow, then we would want to for sure pursue other diagnostics like abdominal X-rays.
I've been cleaning it 2 or 3 times a day too, to try and get all the gunk out of there as well. But
Super well behaved though.
She's so good.
yeah, no, she's really good. Yeah, she's always been good.
She's loving it.
You like the attention, girly?
She's like,
She is all about the people.
All about the people.
That looks 100 times better though. Yeah, I appreciate it. Thank you so much for getting her
The good
in.
part is it all looks like it's really healthy. So
Yeah.
it should heal on its own
Yeah.
regardless. It just will take a little bit longer.
So Klein is, I think, 11 and presented with not wanting to eat a couple days ago. So we did blood work and urinalysis and diagnosed him with a urinary tract infection. So we put him on antibiotics and anti-inflammatories, but he's still not wanting to eat. So we're just gonna do some more diagnostics on him today. So I'm gonna do an X-ray and an ultrasound and to see if there's anything else that we can find on him and get him eating again. He's very sweet. They call him King Klein. And he has an evening pickle. So he's got a little stuffy that he goes and carries around like a baby at night, but only at night. He's very spoiled.
8 or 12 centimeters, do you think?
12. I'd probably do 12, yeah.
Yeah, he's a big boy.
So this is Klein's radiographs. So I'm gonna send also away. There's a bit of consolidation in the lungs. Potentially like a bronchitis. There you can see the microchip. Heart outline looks pretty decent. Liver margins do not look enlarged. There's a bit of gas in the stomach. Kidneys look okay. There's a lot of fat. Discospondylitis here. So essentially arthritis in the back, not uncommon in an older cat. We're not mega colon or super constipated, something that I was worried about. Do you have his harness on?
He doesn't have anything on.
Oh, no way! He was shot! So that's a BB pellet.
Too low.
So they had said that he had a rough life when he was younger. He was a rescue. So, an alley cat. Just taking a look at the abdomen now with ultrasound because I had diagnosed UTI previously. I just wanted to take a look at the bladder, but he also hasn't been drinking much. So bladder looks small. Okay, I'm not seeing anything obvious. So can we just take the treatment table and I'll just do a physical?
Yep.
Please.
Go, buddy.
We did repeat blood work, so we've sent that off to the lab. We included bile acids in that, so that is an indicator of liver function. So we just wanted to make sure that his liver is okay. X-rays were pretty inconsequential, so what we decided to do was elect for subcutaneous fluid therapy, so put 150 milliliters of saline under his skin just to provide some hydration support. We also gave an anti-nausea drug and an appetite stimulant as well, and that will hopefully get him back to eating again, and we'll just retouch base tomorrow. Fingers crossed that Klein responds well to the medication and gets back to eating. Then we can schedule the dental that we've been delaying because he hasn't been feeling too great.